The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Ageless Health with yours truly. We have a great program for you, as usual. We're going to be talking about your headaches that you wake up with in the morning and where they might be coming from. You know, you get going, they feel a little bit better, but nevertheless, they're there, and there's a real rationale. It's an actual diagnostic point that you need to consider when you're looking at why those headaches are there, and they could be for a lot of reasons, but we're going to get into something that you may not have suspected. And it has to do with your fight-flight system that we've been talking about, your adrenal system, but also thyroid function. So pay attention. We'll get to that. But before we get into the program, I'm very excited about something that's just taken place. Beginning on November the 1st, I'm going to be syndicated on the John Fredericks Radio Network. And we're going to be doing Saturday mornings from 8 to 9 o'clock. Please join us. Now, how to find out which stations that we're going to be on, all you have to do is go to the John Fredericks Radio Network.com, and that should be it. There'll be a whole listing of what we're going to be doing. I'm super excited. I'm very flattered. I'm very humbled that we're going to start expanding all the information that we share with you to many other people throughout the country. And we have something else coming up planned, but I'll let you know when that happens. So if you want to find out where we're going to be on Saturday mornings from 8 to 9 o'clock, join us on the John Fredericks Radio Network.com and tell all your friends about it. And we're going to be really excited about bringing you some amazing information and products and preferred providers and so forth. Having said that, let's get into the program. We're going to be talking about your fight-flight system, your adrenal system, your adrenal dysfunction, and your thyroid. I want you to think about it this way. One of the things that drives people into doctors' offices more so than anything else is a headache. But the headache that we're talking about is this dull band-like headache around your head, and it's kind of makes you feel sick to your stomach. And as you get up and you start moving around, it starts to abate, it starts to go away. But it seems to be always there. It's almost like a cloud over your head and not feeling really good ever. It's that dullness. And is it sharp shooting? It can be, but that's usually not how it starts. But it's just constant, it's chronic, and nobody seems to be able to diagnose what it is. Well, we've had a lot of experience with that over the period of many years. And what we find in that particular situation is a finger pointing to a major organ system that we've been talking about, and one that we've kind of added on as we've gone through. And first one is your adrenal system, those little glands that sit on top of your kidneys, but also has to do with thyroid function. Now, if you go back in the old traditional textbooks and you look up thyroid function and the symptoms that are associated, one of the prodromals of indicating that there is a thyroid function is it's called a hat band headache, all the way across like this. Now, that hat band headache comes from the relationship to that adrenal system, that adrenal fight-flight relationship, that HPA axis, hypothalamus, pituitary, adrenal. And we've been talking about constantly. But I want to go over some of the things that will trigger it, some of the things that you need to be aware of, and not let somebody tell you, well, you know, it's take a couple of aspirin, call me in the morning, or you're just not getting enough rest, or you're not sleeping deeply enough. You know, all those things may be add-ons, but why? Why is it there to begin with? So to understand that, we really have to understand how that adrenal system can cause these early morning problems. So when we're looking at the adrenal system, the adrenal glands, these little fight-flight patterns that defend you, if you will, I'm being very elementary with all this right now, it can cause headaches. It can cause other things. That headache can be a nausea type of headache as well, and you're just wiped out all the time. But the symptoms may indicate a reduction, a low level of cortisol. You know, that fight flight, everybody's worried about too much. Well, this is the opposite. This is when the cortisol level goes down. And taking extra cortisol, like some of the medical people want you to do, can actually make things worse over a period of time. They're going to tell you that it can help prevent the symptoms, and it does for a period of time, but then over time, it gets worse. Here's why. Adrenal system is one of those organ systems that if you put too much hormone in to bolster it, to bring the system back up, you stop it from producing the necessary hormone that you have to have. So now you're dependent on drugs continually. So, there's a quiz you can actually take on your own relative to how this goes. Do you have these moderate headaches? Are they there? Are they across your head? Does the pain feel like you're just in a fog? Does it cause that little bit of nausea? Is there sensitivity to light when you get up in the morning? Can it last, continually? It gets better. But if you answer yes to all of these things, and it's a low-level, moderate headache that just never, ever, ever goes away, that's finger pointing to your adrenal axis, your HP axis, your hypothalamus pituitary adrenal. So if we don't diagnose it properly, it can't be fixed. So let's start with why that's there to begin with. The idea that your adrenal system has all these interconnected pieces basically tells you that it's one of the most critical organ systems in your body, probably next to your brain and your heart, because even those guys can't work without the adrenal system being optimized. So when we look at that low energy, that dullness, that brain fog, and then it goes into irritability. And then if you go long enough, because it's messing with hormone systems, then all of a sudden you end up with migraines. So if that's the case, how do we find out what the triggers? And more importantly, can it be fixed? And I want to remind you, coming up on the 22nd, this coming Wednesday evening at the Roselle Center in Fairfax, we're going to be doing a whole evening on adrenal fatigue. And we've coined it tired of being tired, but we're talking about pain patterns. We're talking about headaches. We're talking about immune system not working. We're talking about inflammatory reactions throughout the body. So if you want to find out how to fix it, really find out how to fix it, but more importantly, what caused it for you, join us. It's going to be at 6 p.m. Wednesday, the 22nd of this month. And to register, and please do that so we know that you're coming so we can prepare for you, is go to drtomroselle.com or rosellecare.com. And you can see it right up on your screen right now if you're doing this on your phone or even on your iPad. Just push the button, get it done, and we'll see you there. It's going to be a fun night. We're going to show you a lot of different pieces of the puzzle. We're going to show you in the topic we're talking about on adrenal fight flight as well. So you can scan it on the barcode. You can call in and register that way, but it's 6 p.m. It'll last about 90 minutes, and you're going to walk away with a ton of data that you can utilize to help yourself. So I'm looking forward to meeting you. And Dr. Jerry Cowart and I will be co-presenting. I'm going to be doing a whole lot of back and forth. So scan the QR code or call Dr. Tom or call the office at 703-698-7117. Okay, let's get back into what we're talking about because this is important. I want you to know how to deal with these crazy headaches and why they're there, why they don't go away. And again, adrenal crisis. Let's put that in a situation because adrenal crisis is prevalent today. And that simply means that people are over the top, either dealing with pain on an ongoing basis. They're burned out because biochemically, everything around us and bioelectrically, everything around us is causing our bodies to break down. All the pollutions in the air, all the cloud seeding, the things that they put into our food sources, the genetically modified substances that we get, particularly in this country, that they don't do anyplace else because the Europeans are far smarter than we are. They won't even allow our stuff to be brought into their country. And then the last piece is that we're exposed to so much talking nonsense. on the computer. We're listening to our, the reels all the time. We're listening to the talking heads on the tube, on the radio programs, podcasts. And everybody says, it's Chicken Little. The world is coming to an end. Well, it's going to happen at some point, but, maybe not now. So why get caught up into it, and why spend your time on things that are negative? Because it'll put you into this adrenal crisis. So when we look at the signs and symptoms, we're looking at that headache and that little bit of nausea, the fatigue pattern that becomes profound. Now, why does this happen? Why do these headaches take place? It's because that cortisol hormone that the adrenal system is producing gets at a very low level in the morning. And when it does that, these are the symptoms that are associated with it. Now, the morning cortisol level should be the highest of the day, not the lowest of the day. And at nighttime, it's supposed to make you tired. It's supposed to kind of draw the curtain down so you can go to sleep, put you in that alpha state, and then you go into theta, and then you go into delta, and you're out cold, right? That's the way it's supposed to work. But if your cortisol levels crashes in the morning, you're going to feel miserable. And you start showing these headache patterns that we don't want anybody to sustain, because they stop you from doing what you need to do. So the adrenal glands and long-term stress-related conditions, besides pain that we've talked about, and irritable bowel problems and inflammatory conditions and so forth, cause these low-level headaches, this hatband type of headaches, and they ultimately leading into things that can be much more severe over a period of time. So let's get into it a little bit more, because I started out talking about that hypothalamus, that pituitary, that adrenal axis, if you will, right? That important piece that keeps you alive. Without it, you're not going to be on the planet. And it's contributed to chronic stress patterns. Now, when I'm talking about stress, are we talking about emotional stress? Yes, sometimes, but it's only part of the puzzle. The emotional stress can come from other stressors in your environment not being handled properly. So these HPA stressors, if you will, can cause the development of all kinds of crazy things. Headaches are what we're talking about, and leading to something much more significant. The HPA axis is a very complex system, and it talks to each other constantly, the hypothalamus, the pituitary, the adrenal glands, and it plays a crucial role, a balancing act, if you will, to regulate any kind of stress response to pain, stress response to biochemical imbalances in your system from outside environment, stress patterns that are due to how you run your brain. Now, if that system isn't working, all these things by themselves can drop you. So cortisol is a hormone that helps manage stress. Everybody says, oh my God, cortisol is putting my fat on. Cortisol is causing these things to take place. Yes, cortisol can do all of those things if it gets way too high, or if it gets crashed and you begin to store it where you shouldn't store it. Now, cortisol is a hormone that has to be present in different levels under different situations. When stress from either a structural component, a biochemical component, bioelectrical, or emotional pattern is persistent, then that HPA axis, that hypothalamus pituitary axis, we'll call it, right, can be fully dysregulated, and it leads to abnormal cortisol levels. It can pop it up and it can crash it. When it crashes it, that's when it leads to that problem. So we talked a little bit about how this affects the thyroid as well, because as I started earlier, the hatband headache is very diagnostic of a thyroid condition. And it causes an inflammatory reaction if the thyroid's not working. It goes more to a Hashimoto's pattern, where you have an autoimmune type of thing that's beginning to build up. But if you have this hatband pattern, you know that you got a thyroid problem that's going on as well. And we can show you, and we'll show you that on Wednesday night when you come to the program. There's neuromuscular responses that indicate, finger point directly to the thyroid, and also let you know where it might be coming from. Now, all of these things, I want you to remember, nothing in the body is set aside independent of other things in the body. So when you have this HPA axis headache, a lot of them say, oh, my head is killing me. Well, over a period of time, when you have a low level headache and it just doesn't go away and it's persistent, it's going to kill you. You feel miserable most of the time, right? So what we want to know is it related and how can we fix it? So HPA, again, I know I'm beating the horse constantly, but hypothalamus pituitary adrenal, the pituitary gland, if it's not being signaled properly by the adrenal glands through the hypothalamus, is not going to produce what? Thyroid stimulating hormone. It's also not going to produce what? It's not going to produce other triggering mechanisms that downregulate, going back to the adrenal system. It's called ACTH, adrenal cortical stimulating hormone. So once you break part of the axis, the rest of that loop also gets beat up. So in this situation, what we're talking about is a cortisol drop. We're talking about inflammation inside the meninges of the brain, the covering of the brain, the dura, if you want to call it that way. And subsequently, we're waking up with these ugly headaches, this inflammatory response that has to do directly with thyroid adrenal dysfunction, or this whole pattern that we're talking about as far as HPA axis. So it's critical, it's important that we understand it. Let's talk about trauma. Now, a traumatic experience can ultimately lead to all of these things. Trauma can lead to a pathological problem. It can cause what we call metaplasticity. That means that the brain can be remolded relative to its communication. Matter of fact, the other night I hosted an online with about 40 doctors, and we were talking about traumatic patterns when it comes to brain dysregulation. And what that really means is that you can have a blow or trauma that leaves no damage that you can discern on an MRI or CAT scan and so forth, but it will result in a long-lasting change in the individual's ability, the person's ability to trigger communication down through the body. So you can get a blow to the head. So here's what happens. It's like a shock to the system. All of a sudden, your mouse isn't working on your computer. All of a sudden, your keyboard's not working the way it's supposed to. The screen's up, you can see it, but you can't get it to do anything. That's what can happen in the body. Does it have to be fully so nothing works? No, it can be partial, but it often and almost always, in my opinion, affects this hypothalamus pituitary adrenal axis. Now, if that takes place, all of a sudden you see many other things take place. People put on weight. They don't know where it's coming from. They get, oh my God, why can't I get rid of this weight? I'm doing everything the right way. I'm not eating badly. Or I just don't feel good. I'm tired, but nobody can find anything that's wrong with me. Everything's marginal. The doctor says, well, it's within the laboratory limits. And by the way, that's another misnomer that you get me on another topic as far as laboratory diagnosis in traditional allopathic community. And we'll have a really emotional conversation here. But let me follow through on the situation. What's happening is the inability of the body to communicate, and it will affect that HPA axis. It causes if you will, we're going to use the word a trauma that recalibrates, in this situation, discalibrates the ability of the neurohormonal axis to talk to itself. And it also happen with PTSD, that the hypothalamus is one of the most important pieces in that post-traumatic stress disorder condition. And because it overwhelms the system, and that fight-flight system gets knocked down. But you can fix it. And this is the most important. This is what I want you to get from this. This can be fixed. First, you got to find out why it's doing what it's doing. Secondly, you got to figure out where's the system broken? Does it break everything? Not necessarily. But does it break some things? Absolutely. And it could break multiple things. So you have somebody that puts on weight, they can't cognate, their cognitive dysfunction goes down the tubes. They don't feel good. They've got a headache all the time. Pick one of them. Which one's yours? So when we're looking at these immunological reactions on top of that, because your adrenal system and so forth is part of that. The first prodromal, the first thing that tells you it may be related to this is that you just don't feel good. You're just walking around in a fog all the time. You have a headache constantly, but you're throwing everything except the kitchen sink at it, if you will. You're taking every drug in the world, and most of those drugs make it worse because they have all kinds of bizarre side effects. So if everything that I'm telling you is true, take a good hard look. Know the facts. Understand what might be causing this craziness to occur. Adrenal crisis is epidemic in this country. We're in a constant state of being bombarded between walking around in pain that we shouldn't have. And that a lot of that can be simply because of the fact that we're on our butts all day long and we don't do anything. It can be that we put up with and just take 2 aspirin and call me in the morning. We can go into a PTS problem because we don't know how to deal with anybody. There's a whole generation at this point that's been affected by 5 years of COVID and being shut down. And they don't know how to engage. They're intolerant of everybody else's opinion. I don't care if you're the left or you're the right or in between. Nobody has the ability to just let things be as they are and say, I don't agree with you, but you have a right to your position. That's the world that we're in. And then we don't eat the way we're supposed to eat. Our food is poison in this world. The drugs that we're taking to suppress the symptoms are causing their own cascade and a downward spiraling effect. We do a test at the Roselle Center, and it's called Adrenal Stress Index, and we run it quite often. And the reason that we do that is we want to see what your actual utilization of cortisol and the levels that are number one. So we take it 4 times in one day. In the morning, when it's supposed to be the highest, should come down a little bit at noontime, should drop down a little lower later in the day, and then at nighttime, it should cascade down so you can go to sleep. Now, we want to see that in a certain pattern. Then we're going to look at DHEA, which I call the mother of all hormones, and that's produced in the outer shell of your adrenal system. And then we look at what? We look at insulin because of the transport of the energy pathways. Then we look at progesterone because it's protective, both men and women. And then we look at your immune system through your IgA antibody reactions. And by the way, your adrenal system is responsible for how you handle gluten. And we call that your gliadin AB IgA antibody. And we measure those things. And then based on that and other diagnostic findings through muscle function response testing, remember every muscle in the body has an organ system that it communicates with. We're able to tell specifically what's going on with you. And if we can find that, guess what? We can fix it. Isn't that great? You can actually put the pieces together. So when we're talking about these dull headaches, we're talking about everything that's exposed to that fight-flight system, that adrenal HPA axis. We're looking at the cortisol. We're looking at the balance of those things. We're looking at your thyroid and really what's causing it not to perform properly. Now, here's how 2 of these things go hand in hand. If your fight-flight system, your adrenal system is not working properly, your inflammation gets higher. If your inflammation gets higher, one of the things it affects immediately is the inability of the thyroid to receive the nutrition, the tyrosine, the selenium, the iodine, the trace minerals that it needs to produce something called T4, thyroxine. Even though that they're available, it can't get into the system. Or if it does produce it, it can't transport properly. And if it can't transport properly, you can't have an effect. The effect is all the things that the thyroid is capable of doing and should be doing, and also regulating your body. Your heart rate goes crazy. You either go into tachycardia initially, then maybe bradycardia, or they tell you you're in atrial fib, and now you need something else, and you're going to have to take all these, these blood thinners and so forth from the medical community instead of fixing the stupid thing and get yourself back to normal. Well, we're going to show you how to do that on the 22nd. So I want you to join me on the 22nd. I want you to come with your questions. Make sure you understand what it is that you can do proactively to help yourself. and to recognize what really is going on. I hope this helps you, because this is the centerpiece, in my opinion, of so much disease dysfunction that is going on in this country. Register today. Go into the QR code, which is hopefully up on your screen right now, or go to drtomroselle.com, or go to rosellecare.com, or call the office, 703-698-7117. Again, I want to remind you that coming up on November the 1st, I'm going to be syndicated on the John Fredericks Radio Network program, and you can find it by going to johnfredericksradionetwork.com and find out what time. It's going to be Saturdays at 8 to 9, and what radio stations that we're going to be on. So pass it on to your friends. Make sure you follow me. I'm going to give you a ton of data. We're going to actually get into pieces. It's going to be an hour program, and I think you're going to enjoy it. I'm really looking forward to it. Remember, I'm here every week on multiple platforms for one reason only: to give you the information you deserve, but more importantly, because I love you all. Have a great day. Bye.